Welcome back to the lectures for EMS 241 cardiology. We're going to start talking about cardiac monitoring. In this first section, we're going to introduce you to the cardiac monitor, talk about a few basic concepts about the cardiac monitor, what it can and cannot do, and what we're ultimately going to use it for. So our objectives include describe the usefulness of the ECG in the pre-hospital setting, explain the functions of the ECG, determine why the ECG cannot accurately describe mechanical function of the heart, define the term electrode, define the leads, the cardiac leads, describe the concept of a vector, and that can get a little confusing, but that is something that I want you to really lean into, because understanding the vector of an electrical current and also the axis of depolarization that the vectors create is going to be important to understanding what's really happening electrically in the heart and on the cardiac monitor. Apply the concept of vector movements to and from surface electrodes to create waves on an ECG rhythm strip, and discuss the concept of lead placement, and then apply that knowledge to calculate the orientation of vectors in the heart based on the waves of an ECG. And so that's a really long objective there for something that in reality is a simple concept. So what is ECG monitoring? Well, we know ECG monitoring as those little squiggly lines on the screen on the monitor. We see them in the emergency room, we see them on the ambulance, we see them in the EMS lab, we see them all around where there's healthcare involved. But essentially what we're looking at is the sum of all the electrical activity in the heart being shown in one particular view on the monitor. So remember, your cardiac monitor, as we're going into this monitoring, your cardiac monitor has several different leads on it that show you a picture or a vantage point of the same electrical conduction as it's going through the heart. It's just going to show you a view from the different areas of the heart as that same electrical conduction is going through. This is an important diagnostic tool, and one of the things that I always say, that you always hear people say, is treat the patient and not the monitor. And that is true to an extent, but you've got to use not only your diagnostic tools, which include your cardiac monitor, but you've got to use your assessment tools as well. And my saying is, treat the patient, not the monitor. But if the monitor matches what the patient's showing you, then treat the monitor, because the monitor is there to help you figure out what's going on with your patient. So what can it do? Essentially, it helps you identify electrical cardiac abnormalities. Now, we know there's two functions of the heart. You've got your mechanical function and you've got your electrical function. And they both correlate together, but the ECG monitor itself is going to show you what's happening electrically within the heart. It can tell you abnormal heart rates and rhythms, abnormal conduction pathways. We know our normal conduction pathway, SA node, AV node, your ventricular pathway and all of that, but it can also show you, hey, do we have something that's happening outside of that normal conduction pathway? Also, it can tell you chamber size, hypertrophy or atrophy of portions of the heart, the chambers, and approximate location of ischemic or infarcted cardiac muscle, which is going to be a very important concept when we start talking about 12 lead. So again, this kind of tells us what it can and can't tell us. It can't tell us pumping action, cardiac output, blood pressure. It can show us a electrical view of what possibly could be cardiac muscle hypertrophy, like we just mentioned, but ultimately you have to have other diagnostic tests to really determine that. Now, one thing that I want you to remember is that although the cardiac monitor cannot tell you pumping action, cardiac output, blood pressure, it can correlate with what you're seeing. And so although we may not run numbers to get precise cardiac output numbers, what we're going to do is assess our patient, and we can get a very good idea of how cardiac output is occurring in the heart, the pumping action of the heart, if it's circulating, just by their patient presentation. So ECG monitoring, from the very start, you've got to develop a systematic approach. You need to be able to analyze the ECG and not just depend on the readout from the monitor when you do a 12 lead, but actually use your training, actually use your skill to be able to determine, is this something that matches my patient? The ECG tracing is only a reflection of electrical activity of the heart, and it does not provide information on the mechanical events such as force of contraction or blood pressure, but again, we're going to use our assessment skills to help determine that. So electrical activity is sensed by the electrodes placed on the skin. So one thing that we need to do is understand that the electrodes are going to be your stickers, all right? So your stickers are going to hook up to your cardiac leads. Your leads are going to be your electrical wires, and your basic 3 lead is going to be your salt, pepper, your ketchup, and then the green, the grass, or whatever you want to call it. But the monitor itself actually will take the electrodes, the combination of electrodes and the lead wires, and then it will determine what lead that you are going to see your ECG in based off of what you select on the monitor. The cardiac monitor depicts electrical impulses on a monitor screen or an oscilloscope. Now, old monitors actually had the green screen where it was an actual oscilloscope. Everything now is a digital output. Electrical impulses present on the skin surface. They're very low voltage, and so the machine itself has to actually amplify the electrical impulses. So what you see on the monitor is just a amplified fraction of what actually is being picked up. We can't really think in terms of how small things are happening in the heart, but we have the equipment and the tools to be able to interpret that to where we can make sense of it. The printed record of the electrical activity of the heart is called the rhythm strip or an EKG strip. And even as we're moving forward, you've got to at least have a 6-second strip printed out if you're going to be interpreting the ECG. So again, talking about the definitions, your electrode is your your electrode is your pad, your ECG pad that you actually put that has the special conductive gel in it, and then your leads are going to be your wires, and then the monitor will determine the positive, the negative, and the ground. So a vector is actually a physics term, and basically a vector is a diagrammatic way of showing the strength and direction of an electrical impulse. And so you've got to put that into perspective with the heart. You've got to have a electrical impulse. You've actually got to have many electrical impulses that essentially combine together to create what's called the axis of conduction. You add up the vectors. So if I've got a bunch of different cardiac cells that are creating an electrical impulse, and some of them are going to be going one way, this way, that way, but the ones that are all going in the same general direction, those will be combined together to create the axis. So if you notice here, all of the arrows here, that one, each one of these represents a vector. But what ends up having to happen is all the ones that are going in this general direction here are going to create a sum of all the electrical activity that's happening to create the axis of conduction, which is represented by this big yellow arrow right here. So electrical axis of the heart is a sum of all the millions of vectors found in the ventricles of the heart. After all of the addition, subtraction, and directional changes have been taken into account, which is what we're seeing here, then they will create a vector for each wave. The P wave, which represents atrial depolarization, the T wave, which represents ventricular repolarization, the ST segment vector, which essentially is going to be the way that the conduction is turning so that the ventricles can repolarize. And then, of course, the QRS vector, which is the depolarization of the ventricles. The ECG is an electronic representation of the electrical movement of the main vectors passing under an electrode or lead. So the voltage, it may be positive. So when you're looking at a ECG monitor, anything that goes above what we call the isoelectric line, which is the line right here, is kind of the middle line. Anything that goes up, just like this arrow represents here, is considered a positive deflection. Anything that goes below the isoelectric line, as we see in this arrow here, is considered a negative deflection. Anything that's going horizontal on the ECG is essentially the isoelectric line, which means there's no electrical current or signal detected. So a very basic concept of ECG monitoring. If you see an upward deflection on your ECG tracing, that means that the electrical impulse is traveling towards your positive electrode. And again, the monitor is what determines which electrodes are positive and which ones are negative based off of the view that you want to see. If you've got a downward deflection on from the isoelectric line, then you've got an electrical impulse and it's traveling towards the negative electrode. So when you look at a monitor, any wave that goes upwards, that's going to be a positive, and anything that goes downwards, that's going to be a negative, and anything that is on this line right here is neutral, because there's no electrical conduction created. And this ends the first lecture of ECG monitoring concepts.